Are you preparing for SCA? Maybe you start the exam and was not successful. I'm joined today by Dr. Stella, a GP trainee who failed the SCA twice. It was very discouraging for her. She had to resit the exam a third attempt. In this video, you're going to learn what Dr. Stella did differently, how she passed the exam. Make sure you watch this video until the end to learn what are the strategies that she used, what helped her to change her preparation and transform it. How does it feel to have passed your exam?
Oh, I can't even explain the feeling. It's a whole mixture of, I'm feeling happy, I feel free, I feel joyful, I feel confident. So much, yeah. It's like all the emotions put together.
What was it like when you got the results then? How did you celebrate?
I didn't even know what to do. To be honest, I was so happy, you know. I was speechless. I actually didn't know what I was, that, I was so overwhelmed. I didn't know what to do. I was jumping. I was calling my husband. Yeah.
So I'm so glad that you passed your exam.
Thank
because
you.
it was very challenging. And was it your third attempt this time
Yes,
around?
it was. Yeah.
What were the things that you did this time around?
I think this time around, I tried to understand the exam. It was a new exam. I mean, the first time I tried it, and I felt like I didn't understand the exam well. So at the same time, I wanted feedback on yes, there was feedback from the examiners, but I also wanted feedback from somebody objective. So understanding the exam. So I went onto the RCGP site, and there were some courses on introduction to the RCGP, introduction to the SCA exam. It had a panel of examiners, and it also had Roger Neighbor.
Yeah.
Yeah, so I went through that. They had, I think, 2 sessions about a month or a few weeks apart, and I attended those to understand what from the examiners, basically from the horse's mouth, what's expected of the candidates, what the exam is, what they are marking, what they are looking for, and how to improve my chances of passing. So that's what I did. And then the other one was also to seek help. And as I was looking online, I found you, I found your videos, I read a bit about you, I found your profile, and I thought, I think you're somebody I could work with. So then I contacted you. Yeah. So that's what I did, understanding the exam from the horse's mouth and seeking help from an experienced person like yourself, who's been training helping GP trainees pass exams for a long time, and seeing the success stories of the trainees.
Yeah. So tell us about the difficulties that you had when you were preparing.
Getting myself motivated for the second time, because of course this exam stings you. You're disappointed, you're feeling low, and in my case I was worried as well about things like visa, because I'm here with my family on a visa. I was concerned about finances. I was concerned about how it will be to extend my training. Will I be in the same practice? Will I change? How will my colleagues view me after, finding out that I have not made it? So those were some of the challenges that I faced. Yeah.
So yeah, it is quite stressful when you're thinking about the visa implications, and also because you've got other dependents
Mm.
and the costs that you have to incur. Tell us about what were the support that you found helpful going through these tough times?
Mm. First and foremost, my faith in God, then my family, my friends, my colleagues at work, my trainer, my peer group at the day release courses. So that kept me going, and also just listening to people who had gone through something similar. You know, I watched one of your videos where you had interviewed one of a doctor who had, I think, done his exam about 4 times, and he was getting an exceptional, I think, 5th attempt. You know, just knowing that there's people out there that's going through what, know what I went through, they've been through it and they have succeeded. So that's what kept me going. Yeah.
Yeah, it's so powerful when you see somebody who's gone through this and managed to pass, then it can inspire somebody to actually go and do their exam again. Because the problem is that loss of confidence, especially after failing an exam multiple times.
Mm.
What allowed you to build your confidence back, Stella?
The first step, I think, as I said, was to seek help. When I spoke with you, I believed that I could do it. You know, so knowing that there's somebody there to hold my hand as well and help me see, other than the examiner's feedback, just somebody to say this is where you can improve. You know, this is how the exam is. This is how you prepare for it. This is, you know, come up with a plan. This is how to do the consultation in the 12 minutes, you know, what to do at which time, you know, how to introduce myself, how to take a focused history, um, how to relate to the patient, how to listen to the patient, how to show I'm listening, how to involve them in the management plan, and how to do, you know, because I could say something which would maybe turn out a bit, it wouldn't come out as well as it should to the patient, which sometimes is a struggle for us from overseas. But just learning how to rephrase it to sound a bit more patient and doctor-centered. As you can see, I had a lot of things to work on, and it was nice to have you to show me those sort of areas when we did the sessions with the role players, the one-on-one as well, where you were able to listen to me, stop me, help me to, you know, rephrase, regroup again, try again. Yeah.
Yeah,
So
so it was not easy. It was quite a lot
no.
of, and I know doing these role plays can be very exhausting. So
Mm,
you put in the work and you're quite rigorous in preparing for the exam. And that is really important because if somebody doesn't put in the work and doesn't apply it, then it's very difficult to pass this exam. So tell us about the score then. What did you score this time around?
I scored 87.5.
That's a really good score. And that, when we compare it to the previous attempt, what was the score previously?
The one previously was 74.5, and the first one I think was 67 or 67.5, if I'm not mistaken. Yes.
Mm.
Yeah.
Yeah. So yeah, it's important to see the progression here because sometimes people don't get the right support and then they miss it by 1 mark or half a mark as well. Um, what do you think that allow you to score much higher this time?
Understand the exam, listen to the patient, get the patient's agenda, because this is a patient who has taken their time to book an appointment to see you. So it's about the patient, and not just listening to answer the patient, but listening to know and to understand the patient, acknowledging what they say, checking again to make sure that I've understood them, making sure there's no red flags, different ways of doing my eyes, making sure I'm aware of their ideas of their issue, what is it that they're worried about, how they would like me to help them. And then the bigger bit, which I know had a big blind spot, was psychosocial. So tying all this into the psychosocial aspect of the patient, understanding, even simple things like where does the patient stay? Who do they live with? What kind of support do they have at home? And then just even delving deeper, even finances, how's their mood? How's, just looking at the patient as a whole, which is an aspect I felt like I was missing out previously, but now tying it all up to get a whole patient, a whole picture of the patient. And then also now when we come up to the management, sharing that with the patient and verbalizing it. I also had a problem before verbalizing my thoughts, and my dilemmas. But this time around, I was able to share with patients, thoughts I have, any dilemmas I have, get feedback from them as well, and agreeing a way forward together,
Hmm.
the patient. Yeah.
So it's quite a lot of things that you had to change in your preparation.
Yeah.
Mention about being curious and asking questions about how is this affecting your patient.
Yeah.
So looks to me like you had to change your attitude as well as in being more inquisitive and
Mm.
wanting to know not just the medical part of the history,
Yeah.
but the psychosocial aspect.
Mm. Yeah, definitely. Listening, and the patients, there are a lot of cues which I realized I also would miss, but just trusting that process is in following the cue. If the patient says something, find out a bit more, as you said, be curious, ask a little bit more as to why that has come up. Yeah.
Yeah, so that's really good. So because one of the aspect of this exam is relating to others that mm, candidates can struggle a lot, especially when it's not coming naturally, and some of the questions could be asked in a formulaic way. How did you answer your questions in context?
Um, just rephrasing, making something sound a bit softer, well, thanking, and also thank you for making this appointment. How are you hoping for me to help today? How are you hoping? Things like that, just that rapport, and a softer way of asking, if that makes sense, the patient. Sometimes we may sound a bit commanding, but just finding a different way of phrasing, um, something, uh, to let the patient know you've heard them and you're interested, and it doesn't sound like an order. Um, yeah,
Yeah, so being more person-centered
yeah,
is really important because under exam condition, sometimes trainees would be doctor centered and just
Yeah.
having their agenda and trying to push that, but then inadvertently it may sound like they're forcing something on the patient, which is what you don't want to do for the SCA. So
Mm.
tell us about the time management. How did you manage your time?
What was very helpful was how you had shown us to what to achieve in what period of time. By at least about, by the fifth, 6 minutes, we should be getting into management. Because before I was finding I'm getting almost to the ninth, 10th minute, and I'm trying to gather so much data, I've forgotten about my I've not left enough time, for managing the patient. So just um, following my data gathering within the first, 2, 3 minutes, checking with the patient. And by the time I'm getting to the fifth, sixth, um, just starting off my management, verbalizing what I think is going on, and starting the management process with the patient, because that gives me enough time to tell the patient what I think, find out from them what they think, give, whether it's advice that's needed, whether it's a referral, whether it's investigations, and explain them. Enough time also to safety net the patient and give any follow-up advice or follow-up appointments, that sort of thing. So making sure I give enough time for my management. Yeah.
Time management is critical. So many trainees don't manage their time very well, and then they're rushing their clinical management, or they find that the management is not adequate. So it looks to me that you were very good at segmenting your data gathering and giving yourself enough time in clinical management to address the problems and solve that problem. Having gone through the exam twice already, the
Mm.
third time when you went into that exam, what was your mindset going into it?
I went in believing I can do it, believing I can pass, trusting the doctor that I am, and also going with I mean, I can use the word a battle plan. If this situation occurs, this is how I will handle it. If I get a blood test result, this is what I'm going to do. If it's an emergency case, this is how I'll handle it. If it's a professional dilemma, this is what I'm going to do. So having that, prepare that beforehand, it is like going into a battle, to be honest. It's going into a field. So one needs to be prepared as much as possible for, you know, what can be thrown at you. So
Yeah,
having watched, for example, your videos, you've got several videos of different scenarios that can come up. Um, for example, in the exam, from the different domains or different capabilities that they're marking. So if I get a pediatric case, I said, fine, I'll make sure I check and things like an antenatal history, how was the child born, how's the development, checking things like that, checking safeguarding, so if I get a professional dilemma patient, I sort of knew how I'm going to go about it, how I will deal with a colleague, whether is it a complaint, is it this? I tried my best to figure out different scenarios that could happen, and how I would work my way around them.
great. So it sounds to me that going into exam, you felt more prepared and you have already anticipated various scenarios
Yeah.
and you knew how to manage these problems if they're going to present. So that sounds really good. Now, if you had to speak with somebody who were not successful in the last attempt, and they're feeling completely lost, despaired, what would you say to that GP trainee listening?
I'll say it is a hard exam, yes, and it's normal to feel disappointed. It's normal to lose your confidence. It's normal to start feeling like you're doubting yourself, looking around and feeling like your colleagues might feel less of you, maybe your patience. That's all normal. But the important thing is there is help out there, you know, find out, get objective feedback, look at the feedback from what the examiners have written, from the exam, go through that with your trainer, go through that with, you know, if you're in, let's say you have a program director, going through that, speaking also to other colleagues, though both those that have passed and even those that have not passed, and looking for a mentor as well to help you through the process. So you can do it. It's tough, it's challenging, but it's possible to do it and to succeed. Yeah.
Thank you very much for sharing your insight. And Stella is a living example of you can do it, because a few months ago, she was in the same position as you if you haven't passed, and may felt like this exam is almost impossible. But once you find out what examiners are looking for, you set a plan and you make sure that you identify your blind spot, learn from your mistake, and do things differently, then you will have a much better chance of passing it and hopefully be able to pass it. So thank you so much, Stella, for sharing your journey with us. I'm so pleased that now you have that weight lifted off your shoulders. What are you looking forward to?
Well, after the big sigh of relief, now I'm looking forward to CCT. I'm looking forward to working now as a fully qualified GP, which has been my dream. Yeah.
If you found this video useful, then I'm sure you're going to get a lot from watching this video. Click the video to watch it. Take care, everybody. Bye-bye.